Hello, my name is Matt Schaefer and I'm the Vice President of Business Line Development at Nordic. I'm here with Tisch, one of our executive implementation advisors, to talk about common pitfalls during implementations and some of the advice that he's seen when embarking on one of these large projects. Zach, tell us a little bit about yourself.
Absolutely, I'm very happy to be here, Matt. My name is Tisch. I've been working in healthcare IT for about 11 years now, and particularly with Epic software for the majority of that time. And I've had primarily implementation leadership roles, so helping a number of large integrated delivery networks, academic medical centers, and pediatric organizations. Everything from kind of initial vendor selection and implementation design, strategy, staffing, all the way through build, development, testing, go live, and post-live support and optimization.
Can you tell us a little bit about the role of an exec sponsor in the project and what's important for them to think about and consider?
Absolutely. I think that any large project like this, there's going to be a lot of layers of governance, and you're going to need all of your analyst team. Obviously, you're going to need project managers. You may have product managers, directors, other levels within there. But ultimately, you need a place where the buck stops, and ideally, that's one of your strongest senior leaders. In many cases, it's the CIO, maybe the CMIO. In other organizations I've worked with, it's been a CFO or a COO. I think ultimately picking the right person with the right mindset is probably more important than the title. But it is really critical, I think, to have that one visible leader, a place where the buck stops, a person that can have 100% accountability and dedication to the project. Mm-hmm. And that's really working very closely with the rest of your senior leadership team, right? So they're probably meeting on a weekly basis, but they still need that one person that's really fully dedicated to the project, that it's their baby, it's what they live and breathe every day. The rest of your leaders still have to run your institution, still have to make sure that you're delivering quality patient care, that you're improving. Most of the organizations that we work with, the Epic project is the biggest and most important project they're working on, but it's typically not the only one on the list, right? So especially with things like meaningful use and ICD-10 and the ACO models and a lot of the growth that we're seeing around affiliates and acquisitions of community hospitals and physician practices and bringing them into your institution's network, there's always other things going on. And so it helps, I think, to have your executive leadership team overall very plugged into the project, mm-hmm. but also divide and conquer a little bit, that you have one clear person that's really the number one thing on their list is the Epic project, and let some of your other leaders help with the other initiatives that may be underway or the day-to-day running of the business.
When you're starting a project, you're going to have to hire 100 or so analysts to join this project. How do you think about taking on something that large for an institution?
Yeah, and it's a real challenge, right? I mean, everything from just onboarding all these people, training, facilities, where do you house them, and really how do you build the culture of that team, right? So one of the things I kind of look back to when I'm looking at how do I staff up a new implementation is really what's the staffing model look like for healthcare? And I think one of the great things about healthcare is if you think about a patient that may be going in for hospitalization, how many different staff members with different roles and expertise interact with that patient, right? So you have everything from your initial registration and maybe scheduling if you have appointments. Obviously nursing and physicians are a huge component of your care. Pharmacy, you're going to see a number of therapists, typically ancillary providers. You have billing staff that you may interact with on the back end. You have dietary, transportation, and so it takes an army of people with a very varied skill set to help get that patient better and mm-hmm. get them back home. And I think from staffing a project, it's kind of that same perspective. You need a lot of different backgrounds on the team, and you want a lot of different experiences as well. So you want to ultimately kind of meld it into a shared culture and get the same vision and goal, but it is important to have a lot of those different skills in your tool belt. So I like to look at first a mix of kind of old blood and new blood. So who are some of our existing folks, particularly in IT, for example, maybe who are some of our strongest people that support our legacy systems, that understand our current workflows, our current infrastructure, and what we're moving from. That's usually a great place to source and to pull some of your strongest people onto the Epic project and then try to backfill your day-to-day role. So really use your expertise and your horsepower to skate where the puck's going and not to support kind of where you are today.
So you mentioned a little bit about project team culture and how that's important. How do you foster a positive culture among this newly created team?
You know, I think if you do anything right, particularly the first couple months of your project, I'd say make sure you get the culture right. That it's really so important. These projects are so much work and such a challenge, and so many long nights and weekends to get it across the finish line, that having everybody rallied around the same mission is really what's going to get you there. I think one of the really great things about getting to work with healthcare and so many wonderful institutions is there's a lot of material there to get passionate about, right? The work that our teams are doing and our customers' teams are doing, you know, truly do have an impact on patient care. They're going to make that experience better. They're going to help people get well faster. They're going to help clinicians identify potential medical problems for their patients faster and hopefully intervene before that problem turns into a reality, and helping to reduce readmissions, helping to facilitate better patient-provider communication and get patients more involved in their care. And so I think first and foremost, the foundation for your culture really should be the mission of your institution. So I've gotten to work with a number of great organizations, Large Cancer Center, for example. That's a really great mission to rally around, right? The team is just so passionate about, the work that we're doing. If this can help in any way the organization's mission to end cancer, that's an easy thing to get excited about, right?
Absolutely.
And when it's 8 o'clock and you're in a room with 10 other people trying to figure out some problem that's really challenging, remind yourself of that. And I think those are things to embed in your guiding principles, and then also just really embed in the team in a number of different ways. These projects are going to be a ton of work either way, and so you can either have fun and enjoy it, or you can wallow in the challenges. It doesn't change what you need to achieve as a group, and I think the more you can get people aligned around that shared mission, and then enjoying their time doing it, enjoying working with their peers, that you're going to have a better outcome.
What do you think makes Nordic different from some of the other consulting firms that are out there?
I think first and foremost, really our deep expertise and understanding of the EPIC methodology. So we have people that have been there and done that have a tremendous amount of years of implementation experience, of certifications. And then I think also just our mentality, particularly our advisory consultants. We're not just going to kick up our heels and sit there and give you advice. We're going to roll up our sleeves, get there in the trenches, and help you work through it, teach you how to work through it. And so we really try to staff people, I think, regardless of the role, if it's a executive advisor or project director or project manager or analyst or a trainer or whatever it may be. We want people that have that expertise, that can give you the vision and the strategy, but can also execute the work. And I think ultimately that's really what sets us apart. We have a lot of folks that can really play a lot of different roles, that can wear a lot of different hats, that can go from working on a very detailed system design issue with an analyst right into a conversation with your CFO about how to manage legacy AR, your overall financial metrics. And I think having people with all those tools in their Swiss Army knife that have passion around healthcare and IT and what we do, and that understand that these projects are bigger than them, are bigger than Nordic. It's really about the institution. And I think when you go into a project with that mindset and with that expertise, you're able to really build a great partnership and add tremendous value. And I think that's what we find with our projects, that our customers really appreciate our dedication and how embedded we are in their team and in their success. And the vast majority of our consultants get asked to be extended, end up staying post-live to help with optimization, I think, because of that attitude and expertise that we bring to the project.
Great. Well, Zach, thank you so much for being here and sharing your expertise with us today. It's been a real pleasure.
Absolutely, Matt. I really appreciate it. Thank you.
Thanks.